Did you know that nearly 1 in 5 cases of erectile dysfunction are actually caused by everyday medications, often with no warning from your doctor at all? If you've been struggling with sexual performance or noticed unexpected changes in your sex life, the real cause might be sitting in your medicine cabinet right now. In today's video, we'll break down the common and often overlooked drugs that could be quietly damaging your erections. And, most importantly, what you should know to protect both your health and your self-esteem. This is an incredibly frequent topic in the urology clinic, medications causing erectile dysfunction, sometimes without the patient even realizing what's happening. Erectile dysfunction is remarkably widespread. Statistics show that after age 40 or 50, at least half of men experience issues with erections. As men get older, approaching their 70s or 80s, this number can climb as high as 70 to 80%. One significant reason for this rise is the use of certain medications, blood pressure medicines, antidepressants, drugs for rheumatological diseases. Today, we'll cover them all, one by one. First up, let's talk about antihypertensive medications. These are drugs prescribed to manage high blood pressure. They're very common in the general population and can have a real impact on sexual health. Among these, thiazides and beta blockers stand out. Thiazides include drugs like hydrochlorothiazide and chlorthalidone, often combined with other medications. Hydrochlorothiazide specifically can increase the risk of erectile dysfunction by 2 to 6 times. Beta blockers, such as propranolol and atenolol, are also widely used for blood pressure control. They can affect not only erections, but the entire sexual response, arousal, erection, and even orgasm. If you haven't subscribed yet, take a second now to hit the subscribe button and turn on notifications. That way, you never miss critical men's health advice and expert tips. Moving on, let's talk about another common group, antidepressants. These are prescribed more than ever for anxiety and depression. The main types linked to erectile dysfunction are tricyclic antidepressants and SSRIs, selective serotonin reuptake inhibitors. SSRIs include familiar names like fluoxetine, duloxetine, and paroxetine, all of which are often associated with erection problems. With older tricyclics, such as amitriptyline and clomipramine, patients sometimes share that their sexual issues began only after starting these drugs, even if they've been taking them for years. It's common for doctors to consult with psychiatrists to see if a different medication might be less disruptive for sexual function. Besides antidepressants, anxiolytics, medications for anxiety can also contribute. Common ones include clonazepam, alprazolam, and lorazepam. Clonazepam, often known as Rivotril or Klonopin, is especially noted for causing problems with both erections and libido. As a practicing urologist for over 20 years, I often see cases like Mr. Harold Evans, a 67-year-old retired teacher. Harold came in frustrated about his declining sexual health. After a careful review, we discovered that his blood pressure medication, hydrochlorothiazide, was a major factor. After discussing options with his cardiologist and switching his medication, Harold saw a noticeable improvement in his confidence and intimacy. There's another group of medications linked to sexual problems, and that's antiretrovirals. For men living with HIV, taking antiretroviral drugs over the long term can make erectile dysfunction quite common, especially with medications like AZT or zidovudine. We also see similar issues with medicines for rheumatological conditions. Drugs such as methotrexate, widely prescribed for rheumatoid arthritis, can also contribute to erectile dysfunction. Then there are opioids, painkillers like morphine and nalbuphine. Not only do these drugs often harm sexual function and trigger erectile issues, but they also carry a serious risk of addiction with regular use. Sadly, many patients grow dependent on the feelings opioids provide, which can directly interfere with their sex lives. Antipsychotics are another group to watch. Medications like haloperidol, commonly used for psychiatric conditions, and anticonvulsants like phenobarbital, prescribed for seizures, may also play a role in erectile dysfunction. And, surprisingly, even some very common everyday drugs can cause problems. These aren't always strong prescriptions. Take antihistamines, for example. Drugs like promethazine, known by the brand name Phenergan, have been linked to erectile dysfunction as well. Additionally, older antacid medicines like ranitidine and H2 histamine receptor blocker have been known to cause issues. While ranitidine has mostly been replaced by newer medications, such as proton pump inhibitors, PPIs, like omeprazole, it's still important to be aware that these older drugs can have lasting side effects, including erectile problems. That's why, when a man comes in for a consultation, it's crucial for the urologist to discuss all the medications he's taking. I always recommend that patients bring a full list of their regular medicines, since ongoing drug use is often the root of these problems. Many times men will say, "But I've used this for years without a problem," not realizing that a side effect like erectile dysfunction can show up much later in life. A medication may suddenly cause an issue, even after years of trouble-free use. For example, as a urologist, I recently treated Mr. George Riley, a 72-year-old who developed erectile difficulties after many years of using antihistamines and PPIs for allergies and stomach problems. Only after reviewing all his long-term medications did I connect the dots and help him make adjustments, which greatly improved his quality of life. Erectile dysfunction isn't always the result of age or underlying health conditions. Sometimes the culprit is hiding in plain sight, your daily medications. As we've seen, drugs prescribed for blood pressure, depression, anxiety, pain, allergies, and even routine stomach issues can silently impact your sexual health, often without any warning from your healthcare provider. The stories of men like Harold Evans and George Riley serve as powerful reminders. You're not alone and solutions are possible. Your quality of life matters. You deserve both effective medical care and a fulfilling, confident sex life. If you're experiencing unexpected changes in sexual function, don't ignore the signs or accept them as just getting older. Be proactive. Review all your medications, communicate openly with your doctor, and never hesitate to seek a second opinion if needed. Bringing a comprehensive list of your medicines to your appointments can make all the difference in identifying the source of your symptoms. Remember, small adjustments can lead to dramatic improvements. By staying informed and advocating for yourself, you empower your health and well-being. Share this knowledge. Start the conversation. Take charge. Your best years may be ahead of you. If you found this information helpful, please share it with friends and family who might benefit. Don't forget to subscribe to the channel and turn on notifications so you'll always catch our latest men's health tips. See you in the next video. Thanks for watching.